and let me once again officially welcome everybody to today's Power of Social Innovation webinar, Igniting Change in Juvenile Justice. Today's event is sponsored by the Malcolm Weiner Center for Social Policy and the Ash Center's Government Innovators Network. I'd like to begin things by administering a poll to get a better sense of who's in our audience today. So if you would, please click directly on your screen the option that is appropriate for you. And you can see those results as they tabulate. Looks like we have a lot of people from local and state government and the nonprofit sector. I'm going to allow a few more seconds for people to participate in that poll, and I have one more after this that'll also give us a better idea of who's in our audience. All right, this is great, and I'm sure our panel is very interested to see who exactly is showing up. We have one more poll for you. So if you wouldn't mind, one more time, clicking on the most appropriate choice. We also have a few other content-related polls that we're going to be administering later on in the event, particularly during the Q&A session. So if at some point you see a poll pop up that looks like this, you don't have to wait for permission. Please just go ahead and select whatever answer is appropriate. And our experts may choose to comment on the results, or they may just continue talking, and perhaps it'll be just something we post after the event. All right. Thank you, everybody, for helping out with those polls. And without any further delay, I'd like to turn things over to today's moderator, Professor Julie Wilson, who is the Harry Kahn Senior Lecturer in Social Policy at the Harvard Kennedy School, as well as the Director for the Weiner Center. Professor Wilson.
Thank you very much. I'm thrilled to be able to do this, to moderate this discussion. I'd like to have a brief introduction of our two speakers. Their bios are available on the screen, and I'd rather leave more time for our discussion. The first person to speak is going to be Tim Decker, who is the Director of the Missouri Division of Youth Services, and he'll be followed by Bruce Kamradt, who is the Administrator of Children's Mental Health Services for Milwaukee County and the Director of Wraparound Milwaukee. One of the things that I find most amazing about and most remarkable about both Bruce and Tim is that they are longtime public servants who have spent many years in state and local government, who have always had their focus on the well-being of the children, the youth, and the families that they were serving, who were unsettled by what they saw going on in state government and in the private sector and in the nonprofit sector, and thought that certainly things could be better for children and families. And so they've dedicated their careers to working within the system, trying to change what's done for children and youth. I've had the privilege of spending time with each of them on the sites, and so I'm now going to open it up for them to share with you, starting with Tim.
Well, it is truly an honor to be sharing our experiences from Missouri with a nationwide and actually a worldwide audience today. The real thing that Missouri is known for is, and pardon the slides moving around on us a little bit, the thing Missouri is really known for is our move from a correctional and institutional approach to juvenile justice to more of a humane, therapeutic, and developmental approach that actually involved closing of our large training schools and moving to small treatment programs located around the state. Now, we're also known because what's remarkable about the effort here in Missouri is that it has been sustained and continued to grow over a period of 25 to 30 years. So beyond igniting change in juvenile justice, what I really want to speak to today is what it really takes to take a systemic approach that actually allows you to sustain your innovation and improve your outcomes over time. What we have found is that this really takes at least 4 things, and you see them listed on your screen today. Of course, you have to have a highly effective strategy or approach. You have to decide what you're going to do differently. It obviously takes leadership buy-in and really a different type of leadership often to both create and sustain innovation. This cannot be done without organizational culture change, and in fact, culture can actually trump everything. So this is absolutely important, and I'll spend some time speaking to this today. And if you want to sustain the change and even fund it and allow it to get off the ground and flourish and grow, you have to build a constituency around the change. And I'd like to take each of these separately just for a minute, and you might be asking those of you who are unfamiliar with us what it is that we now do that's different than perhaps what occurs in deep-end youth correctional agencies across the country and perhaps across the world. One is that we moved from our large institutional approach to small programs where the youth are kept close to home. And it's not just programs that are all hardware secure. We operate what we call a least restrictive continuum of care that really begins first with trying to divert youth from our custody in the first place by serving them in their community through the court system and through local partners, and then moves up to community care programs that are similar to what Bruce will talk about today, to group homes, 7 group homes that are 10 to 12 beds in a neighborhood and a community, moderate care programs, 18 of those, and then 7 hardware secure programs, which are what you typically might know with the hardware security like defense. But regardless of where those programs are located, they're all established as a humane environment. So the idea is to create an environment that is comfortable and supports a therapeutic approach. So safety, and everybody has to be about safety in their programs, is created through structure, supervision, and facilitation. The environments are very comfortable. You would see living rooms, and instead of individual cells, you would see dorm rooms with bunk beds. And trying to create an environment that in some ways is natural and home-like, but in other ways is very structured and very purposeful and deliberate in the activities we're engaged in. The real focus is on developing enough emotional safety that youth can truly get to the root causes of their behaviors, of their challenging and problematic behaviors that have been exhibited in the community. And for that, you cannot have them in an institutional or correctional environment and simply have a therapist come in and see them, a couple times a week, because they're going to take on the demeanor of their environment, and if they're not feeling safe enough to really be themselves and really dig into some of their deeper feelings and thoughts and so forth, then you're not really going to be able to create internalized change. So that's kind of the idea behind the humane therapeutic environments. We also use what's called a group systems approach. All of our youth, none of our programs are more than 50 beds, but even a 50-bed program, just like any other, is all divided into separate groups of 10 to 12 youth, and the groups do everything together. They go to school together, they participate in the treatment process together, they do chores together, and the idea is to have them in an experiential group process where, again, they can develop that emotional safety, but also where they can have lots of opportunities to actually learn by doing and learn by discovery. So these very safe groups, daily group meetings, a process where anytime anything is occurring in the group, anyone, staff or youth, can call a circle up or a group call, and everyone stops what they're doing and engages in a very socially competent conversation that can be everything from sharing feelings, getting feedback, restating expectations, working out conflicts, etc. They really learn how to live in a group, and they're safe enough in this group to share with their peers and the staff what's really going on and what are some of the things from their past that have contributed to their current behavior. The other aspect is what we call a fully integrated treatment approach. Many of the approaches you'll see in juvenile justice either focus on cognitive behavioral therapy, punitive or behavior modification type of programs. They may focus on skill development. They may focus on trauma type of work, although that's not real common in the juvenile justice field. The idea in Missouri is to incorporate all of those, that youth not only need to think differently, but they also need to become socially competent. They need to become aware of their feelings. They need to delve into their past experiences. We also have to deal with them in the context of their family system and their community system and understand the roles that they have taken on in those environments and how that would then play out in the group and how that's an opportunity to actually have a different kind of corrective experience in the program. The other thing that's been pivotal for us is the full integration of treatment and education. We as a system are a school district, an accredited school district, and we directly operate the educational programs in all of our facilities. I call them a therapeutic one-room schoolhouse because what you have is the same 10 or 12 youth that are in the treatment process are also attending school together every day with a teacher and a youth specialist. And anything that comes up, many of you know that youth in our system have not struggled academically because they're not smart or not capable of learning. They've often struggled because of social or developmental issues that have to be addressed, and often because they may learn differently, so that the educational strategies have to be structured a little bit differently. 34% of our students have some sort of learning disability or other thing that impedes their learning, which is about 3 times the general population in our communities and in our school districts. So the idea is to integrate both the treatment and education. We also began in the early 90s, this was a second wave of our change, to implement a universal case management system so that the same service coordinator that visits the youth in the detention facility once they're committed and does their classification and recommends placement is also the worker that works with them while they're in residential care, works with their family in the community while the youth is in residential care, and then handles the transition and the actual aftercare status throughout the process. So there's a total continuity in the advocate for the youth and the family. There's no probation, parole, institutional casework, and all this constant handing off that occurs in many systems. And that's very deliberate about keeping the treatment individualized and ensuring that the youth's needs are met. And then families are really important to us, and I will get to that a little bit more in a minute in terms of family therapy, engaging families as a regular basis in the treatment process, and then engaging the community, which I'll also talk about a little bit here in just a minute. One of the things that we often say to people who want to understand the process for replicating the kind of results that we've achieved is that when you really want to change your end destination, in other words, your outcome, it often involves starting from a fundamentally different place. And that different place for us was really, one, being dissatisfied, as Dr. Wilson talked about, with the results we were achieving, but also making an agreement to fundamentally view the young people and families we're serving differently. So we had to really change our perspective and our philosophy about how we even saw the issue of juvenile justice and then how we saw the people that we're serving, which really then laid the groundwork for culture. Culture, in our definition, is broadly defined as how we do business around here. So there's a certain way of operating that is really the culture, and when you include both philosophy and culture and exemplary practice, you really get the results that you're seeking. Often in evidence-based practice, in other practices that often get recommended sometimes as programs, the piece that we miss is attention to the organizational culture and the overall philosophy. So we believe that it's very important to attend to that. Now, talk a minute about, I'll take each of these things quickly, talk about our leadership approach. Obviously, one of the roles of leaders is promoting a new vision for the system. Sometime years ago, leaders said, we're dissatisfied, we want to do things differently, we don't believe this institutional approach works, and they began engaging people and helping shape that vision and a new mission for the organization. What it really took was people thinking and operating systemically. We're very much grounded in family systems theory and organizational systems theory. So understanding how you may make a change in one part of the organization that affects another part of the organization, and how you set standards and boundaries and hierarchies and systems in place that actually reinforce your change, and that really avoid my second point here, which is neutrality is so important, because often it's easy in our systems to get into blaming the families, blaming the youth, blaming the staff, blaming the broader system, as opposed to saying accountability is really about how do we fix it, how do we get to a fundamentally different place. One thing that's endemic in juvenile justice is what I call symptom chasing. We have lots of kids with drug problems, so we developed a lot of drug treatment programs. We have lots of sex offenders, so we developed a lot of programs for them. We have gang issues coming up, so we try to deal with the whole issue of gang prevention and intervention without really looking systemically at what kind of environment that we're creating for the young people and what are really the root causes and issues that we need to deal with. So this really requires an attention to not just restructuring our system, which is, how the system is set up. In our case, small treatment programs located in the community, structured with teams working with groups, et cetera, but also what kind of training and preparation are the people going to need? What are going to be the genuine challenges about implementing change with people? How do you attach meaning to that and purpose? Why are we doing this? What is the symbols are so important? In our case, everybody that works for us has stories about young people that nobody could work with, they thought nobody could work with, and we somehow overcame, and what it took in terms of creativity and innovation that occurred on a day-to-day basis. And then you can't escape the political dynamics and power dynamics, because whenever you go to implement a change, it's going to upset the apple cart and the equilibrium in the system in terms of who's in power and who supports what approaches and how that kind of plays with the general public and the coalitions that you have to build to support the change. So in leadership, we wind up doing a lot of work around aligning and orchestrating, but we also have to do management. We have to engage directly with the operations on the ground. One of the things you'll find is that myself as director, my deputy directors, our regional administrators, we know the names and stories of young people in our programs. We get directly engaged in listening to the staff, listening to the young people. If you come to a Missouri program, all of your tours will be conducted by the young people themselves. So we really know what's happening on the ground, and we're directly involved in that. At the same time, we realize we have to align the overall organization. And then there's a part of this, and I credit Julie Wilson with really labeling this for us, but we have this kind of do what it takes kind of philosophy. That's this, we're accountable, we're also determined, so we have this kind of mix in terms of our attitude of being proud and hopeful, but also chronically dissatisfied. That's what makes us always want to make the system better, because we're never happy with how we're doing, and all you have to do is look at outcomes, and if 70% of your kids are successful, there's 30% are not, so we're not doing good enough yet. So there's this constant dissatisfaction built into the system. One of the most important things to us in implementing our change was really being very deliberate about our beliefs and philosophies. So, we talk about programs being research-based or evidence-driven. I think we always need to pay attention to those things. But for us, it was also being very deliberate about our values and our basic principles we were going to operate on, and being sure that every decision that we made was congruent with those basic philosophies. That was kind of the lens through which we look at the world. So then when you go to look for practices, you look for practices that are in keeping with your value set and what you believe in. And this is really how you begin to build organizational culture. And you'll see what some of ours are here. We do have a comprehensive list we could provide to people, but you see this is so different in terms of how positive these are. People do desire to do well and succeed. We don't think any kid got up in the morning wanting to fail, that all youth hunger for approval and acceptance, that we're really more alike than different, staff and youth alike, that we got to see the connections and similarities and not somehow see the young people and their families as different, that behavior is often a way that youth have learned to meet their needs, that people do the best with this is one people sometimes have a hard time accepting, do the best they can with the resources available to them. So obviously in their experiences, their behavior may seem very logical, but we help to expand their experiences and also their skills and resources. This last one, and I know we're going to talk more about this today, about the family being absolutely vital to the treatment process, that family expertise and participation has to be involved. One of the first things that we talk with families about is you're the expert. No matter what we do, we will never know your young person better than you do. And then we begin to operationalize that by asking them real questions. What do they like to do? What types of skills and talents do they have? So they see that we're serious about it, that we're walking the talk. There's no way around looking at the people in your system and whether or not you have an effective team approach. Jim Collins in Good to Great talks about getting the right people on the bus. So we talk often about hiring for heart, that sometimes clinical qualifications are less important than actually having the people who can really work with kids and who actually are coming at it from the right perspective and are going to be consistent with our beliefs and philosophies. Because those frontline staff in our systems are the ones engaged in providing the actual direct treatment, as opposed to clinicians that we bring in to supplement their work. So our staff are not custodial. They operate on consistent teams, low staff-to-child ratios of about 1 to 6, so that there's a consistent team working with each group of kids, so you can begin to develop culture in the team as well as in the group, and that there's really high team standards and individual accountability, and those are very deliberate. Also the idea that we do not ask people to go where we're not prepared to go. So a lot of our training is some of our staff actually having the experience of what it's like to be in a group and what it's like to share experiences and what it's like to kind of be on the other side of this equation. Also very important if they're going to work on real issues with kids, they have to be in touch with where they're at with those issues and be prepared to facilitate from a stance of neutrality. Very critical in our system. And then this effort would not have been sustained all these years without a real deliberate effort toward constituency building. We have and have for years a 15-member bipartisan advisory board, no more than 8 members of any single political party. No legislators necessarily serving on it, but a lot of judges and civic-minded leaders who all share the common vision with us of caring about the young people we serve and advocating for their needs. This has been an absolute critical, and this is in state statute, that this group is established as a liaison to the executive branch and to the legislative branch. So these folks meet individually with legislators as well as hosting events in communities and so forth to bring community members into our programs. Kind of a second evolution of this was developing of community liaison councils at the community level. So each of our programs has a little bit of an advisory board themselves, and most importantly, an opportunity for community members to actually come in and become directly involved with the youth. One way to dispel faulty assumptions or beliefs about youth in the juvenile justice system is to give community members direct exposure to them and get them to see that they're young people who have had challenging backgrounds but that are gifted and talented and resourceful and articulate and all those things that youth can be in the right kind of program. Also, how you work with parents and families and building them as constituents and allies. Their experience often is one where they were genuinely involved and they become wonderful spokespersons and ultimately the kind of advocates for your system. Being aware that youth in the system are going to have to get involved in ways to restore and reciprocate the help that they've received, so restoring perhaps damage done in the community, showing that they, have an empathy and genuine caring both for their family, their community, their school, and also that they're going to give back. So there's a lot of that kind of built into our system. And this idea that we're kind of this open, transparent, always improving system, people are always amazed at how openly we share information and how many tours we have of our programs, and that those are always led by youth in the program as opposed to staff. You're going to hear a lot more talk, I think, today about building of relationships and how you build on positive stories. So there's this concept that whatever you focus on grows. So the experience with one young person or their family or community can be the building block for your next experience, and we shouldn't underestimate the value of stories in building momentum around the system change that we're trying to achieve.
Tim, before we move to Bruce, I've been monitoring the questions as they're coming in. And I think there are a couple that it would be useful to answer now. One of the questions is, do you really have the difficult, violent youth in your system? And my understanding from visiting is that you work very closely with the judges in the circuits in Missouri, and you use part of your funding. You let the judges compete for that funding so that they can build services and supports in the community that their specific community needs, which, given the state of Missouri that ranges from St. Louis to some very rural areas, suggests that different supports are needed in different communities. So one of the reasons that your system works is the therapeutic model that's focused on education, on getting in touch with yourself and your family, and on career planning for those youth that are the most challenged with the most difficult histories, but also being able to divert those youth who don't need to be placed into residential care into community-based facilities. And so maybe you could speak briefly to who actually ends up in these residential placements, what's the cost, how does it compare with the larger training schools, and what is the outcome for these youth?
Yes.
What's the recidivism rate?
Yes. One of the important things to understand about Missouri is that we work with 45 family or juvenile court circuits, and we do provide juvenile court diversion funding as well as counties and circuits have their own kind of systems in place. Of the over 36,000 juvenile referrals that there are in Missouri each year, we receive about 1,100 to 1,200 commitments. So we're receiving the youth who either have the most serious offenses, the most habitual types of offenses, or those who have had kind of the longest histories in the systems that cannot be dealt with at the community level. So we are really dealing with the very deep end of the system and you can see some of the statistics here on your screen, about 66% of our youth have a felony history. Others, the misdemeanor offenses and some of the juvenile offenses are actually probation violations, so those are felony offenders as well. So we're really dealing with the deepest end of the system. And you can see the other stats, which probably roughly mirror other systems in terms of educational disability, prior mental health experience, mental health diagnosis, et cetera. And then about 2/3 of our youth are actually from the metro areas. So we are dealing with that deep end, very difficult population, and that's why most of our youth go into residential care for at least part of their time with us. Now, in terms of the actual results, I'll share a little bit of information here with you. We measure, and this is another important thing, we try to measure positive as opposed to this concept of recidivism. The real issue is how many actually are successful, because that's what you want to grow. So 3 years after discharge, and this is actually when we're completely done working with youth. This isn't covering their time on aftercare, after they leave the facility. So they're in a facility 6 to 12 months, aftercare maybe another 6 months. So this is when we're no longer working with them at all, is when the clock starts. 93% have avoided further incarceration. Now keep in mind on the front end, virtually all of these youth needed some form of incarceration. And even 3 years later, 2/3 of them have avoided any further contact with the juvenile justice or adult corrections. We also, about 86% are productively involved in their communities through school or work, which is really important for us to measure productive involvement. Now, there's a couple other measures I'll share really quickly. If you're comparing educational progress, for instance, I talked about this integration of treatment and education. 95% earn high school credits as opposed to 50% nationally. Look at the GED and high school diplomas. In fact, that's up now to about 1/3 of our youth as compared to 11% nationally, so about 3 times what you see nationally. And then you'll see some other statistics there about educational improvement. And then lastly, and this is not so much an outcome as much as it is kind of an indicator, within our facilities, youth are 4.5 times more likely to be assaulted in youth correctional programs than they are in Missouri DYS programs, and staff are 13 times more likely to be assaulted. So these programs are safer, and they work, and for about the same cost as other programs. Depending on the level of care, remember I talked about having that continuum of care, about 6 months in a residential program will cost about $23,000, $24,000 in Missouri on the average. So if youth stays a year, it's about double that, and then you figure in the kind of cost of aftercare and so forth. So whether you compare daily rates or annual rates, it's either the same or lower cost, safer, and better results.
Okay, and the fact that you have services in the community to support youth, and Missouri is trying to grow these, is a great segue to Bruce, because what Wraparound Milwaukee has done is created a marvelous system of support for youth and families in their community. So Bruce.
All right. Let me just go to my PowerPoint here. I'm going to go back to the very beginning here. Okay. I'm pleased to be with everyone this afternoon and to follow Tim, who I've admired for a long period of time. There are many similarities between actually what Tim does and what we do in Wraparound Milwaukee. And you say, well, juvenile justice to mental health, where are the similarities? But philosophically, programmatically, there are many things that are similar in our approaches. Wraparound Milwaukee is what we call a unique system of care. We're not a building per se, but we're a way of organizing services in the community to provide mental health and supportive care to children with the most serious emotional, behavioral, and mental health needs and their families. Our emphasis is on community-based care and on creating alternatives to institutional placements. And if children go into an institutional placement, to keep that placement really as short as possible, since many times we can provide the services in the community. Now, 40% of our youth themselves are adjudicated delinquents with a mental illness. So we also work with kids in the child welfare system. We also work with kids that are simply referred voluntarily by, by their families. We serve, last year we served 1,400 youth. Usually we're serving somewhere in the neighborhood of about 900 youth and their families on any given day. Back we go. Why was it created? There were in Milwaukee County, we began Wraparound Milwaukee in 1995, and at that time, 95, the early 90s to the mid-90s, we were simply placing too many children in psychiatric hospitals, in residential treatment centers, and in juvenile correctional facilities, in state facilities. The increase in these institutional placements was creating some huge budgetary issues in Milwaukee County and for the state Medicaid program for juvenile justice and child welfare. We were creating issues where they were causing year-end very large budget deficits as the number of kids in institutions rose. And the clinical and program outcomes at that time were very poor, particularly around very high recidivism rates for juvenile offenders. Something like 60% of all of the kids that left the residential centers returned to the system within 6 months. A high number of AWOLs, very large recidivism area in the Medicaid and hospitalization. So there was some significant issues, both programmatically and budgetarily, to kind of create an opportunity and to create an atmosphere where something really needed to get done. Now, some of the innovative approaches that have been adapted in Wraparound Milwaukee with, with limited time, we can't go into all the details in the program, but some of the approaches we've used are very similar to some of the things Tim talked about. One is we've gone to a very strength-based, highly individualized care model, which is really around whatever a child and family needs. We will provide those services. We don't believe in the adage that one size fits all. And if you're doing this well and you have 900 children, you should have 900 very different plans because every child and their family is very unique. And we do it around strengths. We build on strengths. We don't look to, what the kids don't do well, since that seems to be pointed out to them more than enough by the existing system. We look for what they're successful at. What do they like to do? And try to build on that. Not the fact that they have, they failed most of their classes at school. What do they have an aptitude for? Is that music? Is it art? Is it computers? We try to really build on that. We use a collaborative model across child-serving systems. One of the things we adapted is one family, one plan, one care manager, meaning that rather than have each individual system provide services and develop a separate plan, we said to child welfare, juvenile justice, special education, is why don't we do one service plan across all the systems? Let's not fragmentate the child and family anymore. Let's everybody get on board and do just a single care plan. So that is one of the huge models. So we develop a single plan across child welfare, juvenile justice, mental health, and special education. Secondly, we pool $45 million in funds across all the child-serving systems. We take all the funding, we break the silos of funding down that have restricted really the flexibility and the ability to provide children and families what they need. We pool all the dollars, bringing them together through various funding means, capitated rates, case rates, fee-for-service, fixed-rate funding. We look for creating incentives for each of the child-serving systems, bring all the dollars together, pool them, make them flexible so that the child and family team, the planning team, has access to whatever services, to whatever dollars they need to secure the services that child and family needs. We created a very unique structure called a care management entity or a public benefits model to manage care. Principally beginning with Medicaid, we created a publicly operated managed care system, but a very unique one that had never been done before, which just targets children across child-serving systems with the most serious emotional and mental health needs. So we created this in order to basically be able to pool dollars for Medicaid and to create a structure that could handle the finance, the hire staff, do quality assurance, outcomes, clinical management, that would encompass all of the specific functions for this one group of high needs youth. We also created a very comprehensive array of mental health services. We tore up all the existing contracts, and we went to something of what we call a managed fee-for-service system. We created a huge network of agencies and a big comprehensive array of services. So there are basically 80 different services that are available to kids and families. So from traditional mental health outpatient in-home to mentors, tutors, job coaches, summer camps, after-school programs, mentors, crisis stabilizers, you name it. Basically, we've really been able to create it, and if it doesn't exist, we will develop it. And we took a network of agencies across the community and basically linked all 200 agencies together and created this vast network of agencies to provide the services based on whatever the child and family team felt was needed, basically can be secured through these agencies. We also created a 24/7 multiple mobile crisis teams so that we could provide crisis intervention 24 hours a day, 7 days a week. We do this also for child welfare, where we do all the crisis intervention work now for the public school system. But the ability we found is that it's so critical to be able to do crisis. A lot of times kids' inability to stay in the community had to do with the inability to provide a service at 11 o'clock at night or 2 o'clock in the morning. And the child and youth otherwise would get picked up by the police, end up in juvenile hall, would otherwise be brought to a hospital and admitted to the hospital. And so it was very important to do this 24/7. We also developed one IT system to link all of the agencies. So we link all 200 agencies on one single information system and one electronic health record, which has been very important to us. And we put a great emphasis on measuring and achieving outcomes for the youth. As Tim was saying, we look at everything from reduction in use of institutional placements to average cost per month, to permanency, to educational achievement and attendance, to clinical improvement based on national normed instruments. So we put a lot of emphasis basically on that. Now, when we built this model, there were a number of barriers, and you're going to hear some of the same things Tim said. One of the things we found was the lack of shared values. People have to align. If they don't align on the values, which means kids have strengths, that you're going to individualize care, that families are going to run their own teams, that this model will be family-directed, youth-guided, that it's very difficult if you can't align on the values. There was considerable turf protection in terms, you can imagine, of sharing resources and funding. There's really a lack of knowledge about how local, state, and funding streams. There was a lot of myths about what could be done and couldn't be done. There were extreme barriers to exchanging information. Part of the problem was mental health wouldn't talk to juvenile justice, saying our information was protected. Child welfare couldn't talk to either system. So we broke all those down, for instance, by going to a single release of information, going to a single electronic health record to do some of that. There were misperceptions about child-serving systems. The beliefs in juvenile justice was mental health didn't serve the tough kids. Mental health didn't at first. There were perceptions about, well, conduct disorder kids that's not an appropriate mental health diagnosis. We had to break down all of those misperceptions and get everybody on the same page. And there was a status quo attitude and really a lack of belief that there was a different approach to treating children. We had to do that through what we called beginning with a 25-KIT project, which was a pilot project to take 25 youth in residential treatment centers with no immediate plan of discharge, both delinquent and child welfare youth, to show that they could be, basically, the belief was these kids could not be brought back in the community. And we did a no eject, no reject, and we brought 17 of the 25 youth back home in 90 days. So we had to prove to the systems that it could be done. So in overcoming barriers, some of this will follow what I just said, but we had to create shared visions based on a common set of values, strength-based, individualized, family-directed care. The administrators of child welfare, juvenile justice, Medicaid, mental health, all had a line basically on that. We had to develop a strategic mindset of how to change the status quo, what our model of care was going to be, and service structures to do that. We had to have a clear focus on who we were going to serve. We had to acquire an understanding of the strengths and resources and needs of the Milwaukee community, how we could mobilize those. Develop an understanding of the major funding streams. How could we utilize and bring those funding streams together to really break down those silos, which were really interfering with how dollars got spent. We had to create ways to more easily share information and data so we could talk to one another, connect our proposed reform and initiative to other federal and state reforms, such as the Comprehensive Children's Mental Health Program at the federal level. We had to create really clear goals and objectives and enlist a core group of very dedicated, committed thinkers and leaders in the community. And we've been very fortunate in Milwaukee is that we've had very good leadership in the various systems that have been very supportive of wraparound. So in the juvenile justice area, in the child welfare area, in the Medicaid and mental health area, we've had people that have really gotten the philosophy, gotten behind it, and are really a very good and committed group of people to help promote and sustain our efforts in Milwaukee. So that's a quick overview of what we've done and learned in Milwaukee.
Bruce, I'm looking at the questions that are coming in, and one is a question of, could you describe a little bit the population that you cover? You do cover all of Milwaukee County, not just the city. Perhaps the full population and a little bit more about it?
Okay, we cover, there's 1 million people in Milwaukee County, obviously the largest county in the state. Within that population, we have 250,000 children aged 0 to 18. We serve approximately, as we said, kids that are average age is 13.5 years of age. The 75% of the kids are boys, 75% of our target group. Ethnically, 67% of our population is African American, about 8% are Latino, so 3/4 is a minority. 50% of our families live at or below federal poverty level. So it's not a population of a large financial means. And from a diagnostic standpoint, our largest group of kids, you can imagine, because we have a lot of kids that are juvenile delinquent, about 60% or so of our kids carry a diagnosis of conduct disorder or oppositional defiant. About 50% also have depression and attention deficit disorder, learning disabilities. About a third have substance abuse or alcohol-related needs. So it's a fairly population that really carries a variety of different diagnostic characteristics.
Okay, this is, we're now going to focus much more on the questions and the process, and I will try to summarize these. There are a lot of questions coming in, and so both panelists have agreed to stay online an extra 15 minutes to keep answering questions. But I'd like you to talk a little bit about the process. Bruce talked about from the beginning, at the beginning, taking 25 youth who had no discharge plan, who basically saying to those running the residential area, the residential facilities, give us the 25 kids, you select them. And within 90 days, having 17 of them home. Missouri actually began with the same situation of taking some youth out of the state training school and seeing what they could do with them. They took the toughest kids and kept taking more and more. One of the questions, Tim, is how large were those training schools coming in? So if you can give us that factoid at some point, but the question is, how did you start? How did this actually grow? What was the process? And I would just like to put in one comment. My sense from looking at a lot of the innovations on the child welfare side, and from talking to the two of you, is very often people on the front line need to see and experience a new model before they fully understand what the new model brings that they didn't have in the old model. And so if you could just comment on how you managed to change people's minds, that'd be great.
Well, one of the things that we often say to people is we don't recommend implementing all of your changes all at once. Sometimes that can kind of shock the system, but sometimes the pendulum just swings right back if you're not careful. So we really did begin, as you stated, our large training schools, Boonville for boys was 650 youth at one time. The Chillicothe Training School for girls was about 350 girls. So even while those were still open, especially the school at Boonville, we began opening group homes and then eventually a secure care program that actually opened in 1975. Boonville Training School didn't close till 83. So with the group homes and with the secure care program, the small kind of learning community type of program, we really got those programs off the ground and began to help people see a better way. And actually that had a real structural impact of drawing down the size of Boonville. So when Boonville closed, it wasn't about moving 650 kids. I think Boonville was down to probably 100 to 150 youth by the time we actually closed it. So one of the other thing I would say is that there is, and we call it professional development now, but there is such a role for training in this process that staff have to be equipped to operate in a little bit of a different way, and then you have to have really intensive kind of management and supervision that actually integrates then what people are learning into actual practice. And really that's the way you win people over is you teach them a new way, but then you actually follow through and model the approach, monitor the approach, implement the approach. We were very deliberate about teaching our leaders leadership models and how to actually take something from theory to practice. That was really important, that it actually worked. And the reality is it didn't work well initially. It took a while for it to really take hold and be successful.
From a Milwaukee perspective, kind of adding to Tim, the 25 Kid Project was very important for us. What we did from that is you have to kind of generalize. You have to have go from your model that you're using to your pilot model to how you're going to implement it. So what we did is basically said, from there we'll go to an 18 months. We'll look at all the kids in residential. We'll look at all the kids at risk of residential. Each month we'll take some from the residential centers. We'll take some that are at risk of residential. So we work both ends of the system. For the judges, it was very important that it wasn't just about removing kids. It was about keeping kids and the community safe and providing them with the alternatives that they didn't have. They didn't want children to be unsafe, and they wanted kids to have services. And those were very, very much keys to them. And to the residential centers, it wasn't about, we knew we were going to be closing beds, but what we said to them was, we're going to need care coordinators, care managers. We're going to need in-home teams. We're going to need mentors, tutors, job coaches, is re-engineer your services. We don't want those long-term stays anymore in residential, but create come forward and kind of create a community-based system, and we gave our providers that opportunity to re-engineer their services. So it's really important to do that, not back people into a corner, but use their strengths also in the community.
One of the things that's very unique about Wraparound Milwaukee, but is very complicated to understand, is your single electronic record, how you manage to develop a computerized database that everyone has access to on a need-to-know basis, that is HIPAA certified, and that has allowed you to blend funding streams. And I realize that you could spend until the end of this session describing this, but Bruce, perhaps you could answer some of the questions of people who are writing in about how you managed that.
Okay, well, the Internet is an amazing tool. So first of all, it's an Internet-based application because that's the universality of bringing agencies basically together. And then I mentioned going to a single release of information across all the systems so that child welfare, juvenile justice, education, mental health, all agree that there's a single release to allow us all to really to basically talk with one another. And then basically, I mean, it was then developing over a period of time. We basically used our care coordinators to help develop the plan so that the philosophy of wraparound, the wraparound philosophy of individualized strength-based care gets incorporated in the model. So the care plan incorporates that. And from there, we did components of the system. We built it from doing the care plan to the progress notes to doing all of the service authorizations across the system, to then putting in an invoicing so that everybody could invoice and bill online, to then putting provider notes online, which is still an ongoing process. We have all the residential, all the group homes, we have all the crisis notes online. So we built it, we began in 2000, and you continually build it over time. So we keep refining it on that way. So you look for it. There are good models to look at out there, but that's really how we went about it and really built it. But it's really based on internet-based, using the internet, since that's the commonality for most of our, for most of our systems. We can't talk directly. We can't exchange information with child welfare in their directly through their SACWIS system, but child welfare has access. They have internet access, so you can create a secured internet-based access on a need-to-know basis for child welfare. So that's really how we've done it.
And I think a couple of other important points are you worked with the judges initially to develop this single form to make sure that the courts were on board with you, right, if I understand it correctly.
Right.
And secondly, you've been able to build in incentives for individual providers to speed up payments to them if they're able to enter everything online. Is that correct?
Yeah, the average time what we've been able to do is it used to take 60, 90, even 120 days for providers to get paid. Now, basically, you get your authorization immediately, and there's 3,000 authorizations going out every month for a service. You can bill every week for the service based on the approved level. The claim gets adjudicated. There's an automatic ledger and check writing system. So the average is 6 days from time of billing, from the time of the invoice to the time a check arrives to that provider. And that makes a huge difference to providers because they don't have to carry large sums of money for a long period of time waiting to get paid for services. It's a real incentive to community-based. One of the things we've really seen is the increase in community-based providers that have come forward, the grassroots agencies that now can really compete on a level playing field with the larger agencies. So it's made a big difference.
A couple of, back to Tim now on the juvenile justice side. One question that's coming through is, do you have any restorative justice program models that you're using? And second is, how do you get around the NIMBY problem that so many agencies face, where communities don't want any of these facilities housed anywhere near them?
Yes. In terms of restorative justice, that is something that is integrated into each young person's treatment plan. So we find that has to be individualized to what their circumstance has been. Often, as many of you know, we're dealing with young people who have been both victims as well as caused harm. So it's really important to pay attention to what their history has been and then how they might best give back or repair. So that's actually individualized to each youth. Now, in terms of the issue of NIMBY, one of the things that's been real important to us has been these community liaison councils who have actually brought private citizens from each community where our programs are located in on a regular basis to the programs to meet the young people, to participate in volunteer work, to serve as our advisors, to act as that link to the community. So you have really spokespersons in the community who are not really paid to be spokespersons or even paid to be at the table, but they're folks who have actually seen firsthand what the environment is and how different it is from what folks' perceptions are. When we last opened a series of programs in the late 90s, we actually had communities competing for those programs, which was not the case in the 80s and certainly was not the case before that.
As you might imagine, there are a number of questions coming through about evidence-based practices. And how do you two think about evidence, and in particular, some of your mentoring programs, some of your counseling programs, what evidence-based do you have, and what insights can you share with people about this?
One of the things that has been really important for us is to, and I shared it in my presentation, is to first and foremost focus on our beliefs and philosophies and our kind of value base, how we view the young people and families we serve, how we view the work of their change process. And then what occurred for us over the years, and this is before, we're talking, 80s and 90s and so forth, before evidence-based practice was really the kind of thing that people were talking about, is that folks tried to locate, we went to extensive workshops and did extensive research and reading and tried to take various approaches and integrate them into our work and kind of find out what worked and find out what didn't work and kind of weave it all together into what has now become our fully integrated treatment approach. So we really pulled from many, many different sources, and we trusted outside expertise, but we never accepted anything as a lock, stock, and barrel kind of model that was exclusive of other approaches that we found working, which has actually been one of our barriers to some of the evidence-based practices, is the practice often push do only our thing, and you say, well, why? Well, because how will we know it worked if you don't just do our thing? And so ours was a very intuitive kind of experiential process of integrating various practices, and the results speak for themselves. I'd like to think that we've done more outcome-based work, maybe as opposed to evidence-based work in its pure form.
Yeah, from the standpoint of, I think we have to be very careful in sometimes in evidence-based practice. Wraparound is considered a best practice. Is it an evidence-based practice? I don't know. But I mean, the fact that many of the evidence-based practices are really based on very small applications with a control group in a setting that's not always kind of level the playing field. By that I mean you take 20. You do an MST with a small group of kids in a cohort of 20 or something like that, and there's nothing wrong with that. And MST, some of the other ones, family functional therapy, are all good models. However, sometimes like with Tim and I, we have the real world of we have to apply it to 900 to 1,400 children. I have to take every child. The court I can't set up a control group of youth, whether they're in the home, out of the home, whatever the parent situation, there is a parent, no parents, whatever. We have to apply these. So like Tim, I'm looking for generalized good outcomes. Are kids going to, high percentage of kids, going to school? Is there a reduction in the kids' recidivism rates if we look at what they were doing a year prior to coming into wraparound? Are we achieving permanency for a high rate of our kids? We do look at some of the improvement in clinical functioning. For us, that's, if we're seeing that and the court's happy because the judges are saying kids are going to school and they're staying out of trouble, that in the end is the determining factor really, really for us. So perhaps there will be more for system of care models like wraparound, but right now we're pretty happy with the outcomes we're getting for youth and having it being a recognized best practice.
Tim, several people have asked questions about how you handle, in your group settings, youth who don't get along with others in the group, altercations, difficult behavior.
Right. All of our staff are trained in what we call an internally developed workshop called Fiscal Crisis Prevention and Intervention. So we really emphasize de-escalation and intervention in a way that actually moves challenging and unsafe behavior to a productive problem solving. So our circle process that we use that's across all of our programs, where any youth at any point can call a circle or a group calls, they use different language for it, and the whole group stops what they're doing to actually listen to feelings, to work out conflicts, et cetera, and the kind of facilitation that goes along with that prevents most physical incidents. There are times when, like other residential programs, we have to be involved in physical restraints, and we really don't have time to go into all the details probably of that today, but what I will say is that how those are handled and then how they're actually processed as discussed as a group afterwards actually acts to prevent the next one. So we really try to get to what was the core issue that was causing the behavior to occur, so that we're not just dealing with behaviors, or we're not intervening in a hostile or coercive way that just builds additional aggression or hostility, as opposed to individual responsibility and stronger group work. So it really is a whole process that our staff are trained in, and I would say that many of those physical incidents, most can actually be prevented. And interestingly enough, when the culture in the group is such that it's a quality, Missouri approach, you see a drastic reduction in those types of incidents. When the quality is not as good, you see an increase, and that becomes a real red flag about the need for further intervention.
I'm hoping we'll be able to fit in two more questions. One has to do with prosecutors. I know that both of you have the support of judges, and one of the things I don't think we mentioned about Missouri is that the courts basically sentence youth to indeterminate sentences, and the Department of Youth Services makes the decision about when youth are ready to leave. How do the prosecutors view you in these situations, in both settings?
Well, one of the things, and this is probably not unique to Missouri, but at the juvenile or family court level, the actual chief juvenile officer acts as the prosecutor. So we're able to kind of bring those folks along in terms of the philosophy and approach, and many are very supportive of it. Most are, because they've really seen it work, and they see, we've already established a partnership because we're offering family therapy services, day treatment, juvenile court diversion. We're accessing services the court has to offer, so we're genuinely kind of partners. So what we talk about often is best interest of the young person, and how something like a determinate sentence can actually be a deterrent to actually effective treatment, which really requires that the youth work their way through the program based on their recovery and treatment process, and that be individualized. So determinate sentences actually cause poorer outcomes, which the courts can really relate to. So we've had really good support. Many of the judges we work with, or a number of them, are former prosecutors or have experience with that. So even when we get to the dual jurisdiction program, where we are actually dealing with adult courts sending kids back, we really do a lot of preventive and early interventive work with those courts to educate them about the process and what works. And we have very significant support for it.
Basically in Milwaukee, since we do deal with a lot of systems kids, what the judges have gone to, and the judges proposed this and put this into place, was we use a flexible order. So the judge will do a finding that this child is committed a delinquent act, supervision to be provided by, but then they will add the care and treatment services to be arranged for and provided by Wraparound Milwaukee. So they make a flexible court order, in most cases letting Wraparound Milwaukee determine what level whether that child does need placement, does not, could remain in the community, and allows us to actually move the child through different levels of care with what we call a notice back to court of change of placement, which does allow the DA or any other party in the matter to basically file an objection. So the flexible order really helps us. We also use for 50 of our kids in a program somewhat similar to Tim's. We have our focus program, which is a WRAP program where the youth are committed to the State Department of Corrections, but the judge stays the order, places them in the wraparound focus program. We use an on-site residential center, unlocked, and the kids stay 3 to 4 months on average, and then basically go into the community. But they get a child and family team and a care manager, and the family stays involved really from the start. So the judges have been very good at supporting, those kinds of options.
We've talked without enough attention to detail, and we could talk about this much longer, about your internal management. You're dealing with the judicial environment. You're dealing with the political environment. I'd like to have you talk a bit more in the last few minutes about your dealings with the community. Tim, you talked about those some, but Bruce, it would be interesting to hear from you. We're now dealing in a political situation where the public is angry. They're angry about taxes. They're angry about a lot of things. How do you persuade the public that in an age where so many people want to lock kids up and throw away the key and keep them in jail for a long time, that they really do need to support these programs and support these youth?
Well, it's a great question. On the one hand, from a community standpoint, in terms of community involvement, the RAP model has been very good because we basically have so many different agencies that we bring into the network. Is that we look at wraparound as a real community strategy, not a strategy to exclude agencies or providers, but to bring everybody in a single network. Two, it's an interesting philosophy to bring. It's interesting because we've reduced the use of state correctional, state residential centers, hospitals. A lot of those dollars flow back into the community and create jobs for mentors, tutors, and job coaches. So wraparound has become an interesting strategy for returning millions of dollars from out of state back into the state to create jobs for services, and providers that support kids and get better outcomes for those kids. And finally, overall, wraparound has really reduced, because of the fact that we've been able to reduce the levels of institutional care so much, the average cost per child has dropped dramatically. And actually, over 15 years, the contribution of both child welfare and juvenile justice, they're putting the same base level of funding in that they paid for out-of-home care in 1995, which is amazing, even though there's 3-4 times as many kids being seen. So it costs a lot less to have kids in wraparound than to have them in institutions. So it's become really as a financial strategy for Milwaukee County, and it's been estimated that somewhere in the neighborhood of $150 million has been saved by by child welfare and juvenile justice alone.
I want to thank both Tim and Bruce, and for the audience who's still tuned in, I hope this has gotten you curious about what they're doing and interested enough to do a little bit more pursuit. As I mentioned at the very beginning, I was impressed by the site visits that I did to both, talking to the youth, talking to the providers, talking to the management and administrative teams. I'd encourage you to check their websites. So thank you, and I'm going to turn it over to Jim, who is going to tell you how you can get copies of the slides.
Thank you, Professor Wilson. I'd like to call everyone's attention to two locations in particular. As I mentioned, we are going to be posting this recording and the presenter's slides in about 2 to 3 business days, pending the presenter's permission. And in addition to those resources, I want to emphasize that we have the Power of Social Innovation website, which features, among other things, the Power of Social Innovation book, which highlights a lot of programs like those we're discussing today. And there are many other resources about social innovation you can find there as well. In addition, we also will have a resources page that will appear under this link. I called it up earlier and was surprised to see that the few links we had posted there have disappeared. They will be returned, and they will be joined by many additional supplemental materials as well. Both these programs obviously have a lot of elements that we weren't able to cover today, and we're going to try to cover that as much as possible with supplemental materials that we'll make available online. And that list should be complete at around the same time that the recording and the slides go up, and you'll receive an email from me when all those resources are available. Back to you.
Thank you very much, and good luck as you move forward with your own agencies.